I'm here with Bonny Specker, Professor Emerita from South Dakota State University, who is going to give us an epidemiologist update report with what has been going on with the COVID-19 situation across our state, across our nation, across our world, and actually in our region as well. So Bonny, what do you have to talk about today?
Thanks, Chelsea. There were a couple things I wanted to just clarify or update people on. South Dakota has seen a huge increase. There's a lot of articles that are coming out in the press, and I just thought I'd talk a little bit about that. And then also there's been some concern about what you do if you have symptoms and the need to get in early. And then I also wanted to mention or discuss the lag that's in the data on the dashboard so that people are aware that it's not really real-time data and that these lags can influence what our trends are looking like. Like we're kind of behind a little bit on that. And then give the weekly update. So to start with, this is what South Dakota is looking like right now. We are seeing a very large increase in the number of cases. Last week we had over 2,000 cases. The week before it was 1,200. We are definitely in high spread and looking very similar to where we were last year in around September. So we're about a month early. So I wanted to talk about where that is coming from. It's mostly out in West River where they're seeing the really large increases. This is Meade County, and they now have more cases being reported than they did at any time last year. And if everyone remembers, Sturgis is happening around here. So this really is no big surprise, given that you have so many people in such a semi-confined area with an infectious disease that is spread very easily. So I noticed this morning on the news, the Monument ICU beds are full. Yesterday, I think there were 1% of the beds that were available. And if you look here at Pennington and Lawrence, this again, West River, this is Spearfish and Rapid City. This is what happened last week. Last week's presentation, I talked about how these were increasing. They were here then, and they've continued to really go up in this past week. Brookings and Minnehaha are about the same. We're sort of vying for third place as far as the number of cases. Almost all 10 of these counties are in high spread. The only one that isn't is Brown County down here, that's in substantial spread. Now moving on to the symptoms, there are a wide range of symptoms reported for this variant, ranging from mild symptoms to severe illness. They occur 2 to 14 days after exposure to the virus, and anyone can have mild to severe symptoms, whether you're vaccinated or not. Vaccinated people tend to have the milder symptoms than unvaccinated people. And I've just listed here the symptoms, and this is on the website, the CDC website link down here. But it's fever, chills, coughness, shortness of breath, fatigue, muscle or body aches, headaches, a new loss of taste or smell, the sore throat, congestion, nausea or vomiting, diarrhea. These are pretty much what they were before, but they can be milder. So a lot of people who think they might be having allergy symptoms could in fact be having this Delta variant, especially if they're vaccinated. The key is that those people still should really get tested, because even if you're vaccinated, you're able to spread the virus, and that is a concern. The problem with the Delta variant is that people are sicker faster with this variant. It really hits people, the especially unvaccinated people, much quicker. It is more infectious, so it's important to know whether or not you have it in order to prevent spreading it. And there is an effective treatment. It's called monoclonal antibodies, and this is extremely good at preventing poor outcomes. But the problem is you need to get it within 10 days of symptom onset. If you wait too long, you won't be eligible for that treatment. If you're asymptomatic, if you were exposed to this virus by someone close, you can still get this treatment if you're in a high risk category. High BMI, overweight, obese, which almost all, I shouldn't say almost all, but a very high percent of South Dakotans fit in this risk category. Or if you have asthma, you can go ahead and get this monoclonal antibody, even if you're asymptomatic. And the nice thing is the treatment doesn't cost anything. The federal government is covering the cost of this in order to prevent these bad outcomes. So what do you do if you have symptoms? You really need to be seen in a clinic because this variant can make you so sick so fast that it's good to have that initial evaluation. If you've been exposed to someone with COVID, but you don't have any symptoms, it's good to just get tested to make sure that you're not positive. And if you are positive and in that high risk category, you can go ahead and get a treatment that will prevent you from getting really sick. Now, as far as the lag times in reporting, I just wanted to remind people that the data that's on the dashboard, what kind of lag there is in that data getting posted to the dashboard. And this is as of yesterday. The last positive test that was reported yesterday, August 25th, were tests that were done on the 23rd. So, the different labs that get these tests, they have to get the results back, and then they have to upload the data to the Department of Health. And it has to be before 1 p.m. in order to appear the following day. So this is causing a lag in when things are being diagnosed and when they're actually posted on the dashboard. So it's a 2-day lag period for positive tests or new cases. As far as hospitalization data, it's about a 1-week lag period because people need to, or the hospitals need to inform the Department of Health, and there's a range of time that can happen. And the data that was posted on the dashboard yesterday, August 25th, anything after August 17th is considered incomplete. So it might not be showing all of the hospitalizations at that point in time. And it's also important to remember that there's a lag between when people are diagnosed and when hospitalizations occur. And that I think is about 8 to 10 days. People get really sick about 10 days after they first come down with this virus. So there's another lag. So we see cases increasing. We're not going to see hospitalizations increasing for a couple weeks after that. Now, death certificates by law must be filed within 5 days of the date of death. And then once those death certificates are filed, and they're filed with the Department of Health, the vital records section, they are then reviewed, and you have up to another 7 days before they're posted on the website. So there could be a lag up to 12 days following the death before it's actually showing up on the dashboard. So those are just a few things I wanted to cover that might be confusing people. So moving to the weekly summary this past week, as I showed earlier, this is Brookings, not South Dakota yet. This is Brookings. We are seeing increases similar as the state is. We had 62 new cases last week compared to 43 the week before. We are in a high level of community spread. And the age distribution of cases during this past week, 29% of them were less than 20 years of age. 37% of them were 20 to 39 years of age. 21% 40 to 59% or 59 years of age, and 13% were 60 years or older. So you see the this age group, the 60 years and older, is actually the age group that has a pretty high vaccination rate. And you can see that in these numbers of cases with those age groups that are highly vaccinated having a lower number of cases. Test positivity, which is another indicator of how well we're doing, is not good at all. We want this below 5%, according to the World Health Organization. A really high test positivity, and we are at a high level, is indicating that there are a lot of cases out there that are not being diagnosed. So, people need to, if you're a contact, please go in and get tested. And like I tested myself last week. I figure if I'm negative, I can contribute to lowering this test positivity. It's a good idea if you think you have any symptoms at all or have been exposed to anyone, go ahead and get tested. The state can send you a test kit. It's really easy to do. And you can get it back and you get your results within a day or two. Or you can go to any of the clinics that drive up. They have drive ups too. And I'm sure the city has that information online. As far as hospitalizations, fortunately, this went down. We only had one hospitalization last week compared to 5 the week before. There have been no deaths, which is also good. Hopefully, that's an indication that people, are getting this monoclonal antibody therapy that's helping prevent these really serious outcomes. If you look at the state test positivity, so this is South Dakota's, it's even higher. It's up to 17%. I think Meade County yesterday, the test positivity was 33%. So they're having, a really big problem in West River, and hopefully we can prevent that from happening here. So if you look at the state hospitalization data, we had 145 people were hospitalized as of yesterday. 37 of these people were in the ICU. This compares to 105 hospitalizations the week before, with 35 in the ICU. So 90 people were admitted to the hospital last week compared to 58 the week before. So you can see these numbers going up here. Again, I've mentioned this a couple times, the number that are in the ICU are pretty high relative to the number that are currently hospitalized, indicating that this could be a more severe variant, or just that people are really waiting too long. The age distribution of hospital admissions this past week, one of them was at less than 20 years of age. 12 of them were 20 to 39 years of age, 28 of them 40 to 59, and 49 of them 60 years and older. If you look at deaths this past week, there have been 3. The week before, there were 5. 2 of the 3 deaths this past week were in the 40 to 59 year age group. Actually, that's 40 to 49 year age group. And one of them was in the 70 to 79 year age group. So cases in the United States this past week, we had over 1 million new cases, about 70,000 more than the week before, but it does appear to be slowing down a little bit. You can see that this increase between these 2 weeks is less than these 2 weeks. So that's a good sign. Hopefully it will continue, but we've had close to 39 million cases. If you look at deaths, we're getting close to 650,000. We've had quite a few deaths this past week. Again, this is showing that lag. We had a big increase in cases a while ago, and now we're starting to see the big increases in the deaths. There were 8,000 deaths last week compared to 5,400 the week before. Globally, we've had about the same this past week and the week before at 4.6 million. So this is plateauing out. Deaths worldwide did go up a little bit. This past week, 70,485 deaths compared to 67,438 the week before. So I just want to remind people that all national and international public health agencies are now recommending non-pharmaceutical interventions in addition to the vaccination in order to control the increased spread that this Delta variant is causing. And some of these recommendations include masking indoors, the socially distancing, avoiding crowds in poorly ventilated spaces, practicing good hygiene, washing your hands, covering your mouth. I mean, things we've been hearing for the last year. And again, monitor your health. If you have any symptoms, go in and get tested. It will help bring our test positivity down if you're negative. And if you're positive, it will help prevent the spread of this virus because you can prevent other people from being exposed. That's all for today.
And thank you, Bonnie. I just wanted to remind people that on Tuesday, the Brookings City Council did pass a new resolution defining some things that they recommend people do to help stop the spread and slow the spread of COVID-19 with the new Delta variant that is now much more transmissible, and the rates are really going up in South Dakota. So there is a quick guide that is on the city's website that defines all of those recommendations within that resolution that was passed. I put a link in the description of this video that will take you right to that page that has more information about that resolution that was just passed and which is going into effect this week. So if you have any questions about that, that is a good place to reference those recommendations. Have a great week.